And then the other thing that we can have them do, when they actively contract their biceps to perform elbow flexion, they are elongating the antagonist tissue. That's the triceps. That's another way to help kind of loosen that tight tissue up. Some of the more intermediate type stretching, you guys have seen it all before, where we do the overhead tricep stretch. So you kind of have them flex their elbow, and they're pointing their elbow straight up towards the ceiling. And then generally you're going to have them put a little bit of overpressure over the top to try to bring the elbow posterior a little bit more. Okay, and the reason why that stretches more effectively is because the triceps does cross the shoulder. Okay, so a little overhead tricep stretching. It's a little more dynamic, and the patient can't have any pathologies of the shoulder or scapula as well. Sometimes I'll have them hold a towel to do a little bit of overpressure on that one. If they can't get their other arm up, say they had a rotator cuff tear, or they hurt their other shoulder, they can grab a towel behind the back and they can provide overpressure that way as well. P and F stretching. Someone want to write down for a minute, please? So remember, the beauty of contractile stretching can work for almost any joint depending on your creativity, right? Go ahead and scooch over just a little bit more. How about supported humerus with palm roll? Okay, so let's say he can't go into elbow flexion because he's tight on the posterior surface. So what I would do is I would take him into flexion as far as he could go. Now, I want you to try to push me away, push your hand back into my hand. Push, 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 and relax. And as you relax the triceps, I'll go further into elbow flexion. Then go ahead and push, 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 and relax. Okay? So we do the antagonist, contract, relax. Okay? And again, I'm stabilizing with one hand and I'm applying and maintaining the force with the other. And the entire duration of the contracting and relaxing should be at least 30 seconds. You can do that. Thank you. And then the only other thing that you can do is do some weight bearing and deflection. So commonly, we won't have patients just go into this, where they get down on their hands and knees and say, okay, now just let your weight go. We'll usually have them start in vertical position against the wall. So if someone's having a really hard time bending due to tight tissue, what we'll have them do sometimes is just gently, and they can kind of gauge how far and how intense they go downward with their opposite arm. But basically, we're going to have them just lean into the wall, and you'll see that I start to go into a little bit of flexion. And there is some assistance of gravity in my body weight going into the flexion stretch. And again, I can make it more intense if I stand further away, okay, because I have a little bit more of gravity's effect going downward now. Okay. Sometimes I'll have the patient stabilize by putting one hand over the other, so their affected arm is touching the door and the unaffected arm kind of supports and maintains the hand placement as we go downward. And then we can progressively go down into the plane of gravity's effect. I've seen therapists have them kind of get down on their hands and knees and kind of lean down into it a little bit. I've seen patients or therapists with more advanced problems kind of come down to a push-up position and kind of sink down a little further. But generally, we're not going to do that until someone is in a very advanced stage of healing, because that puts a lot of force on that tight tissue, and we don't want to rupture anything just to make some gains. Okay, let's say someone needed to work on elbow extension. I already kind of gave you the indication from my clinical experience that this is common and that we have to work on this. But remember, Beth and I want you to remember that the biceps is a two-joint muscle, so to effectively stretch it at times, you need to be mindful of the shoulder position and the elbow position. Because if you're in too much elbow flexion, and you try to flex, you may not fully be elongating that tissue. You need to come into shoulder extension and elbow extension to fully elongate the biceps, if that is the barrier to your ability to gain range of motion. Same kind of things. I think I'm just noticing that there's an error on our sheet. Number 2 should say